Okay, welcome to ET for you. Okay, today we are going to discuss about the case note Joshua Vence. So, as you know, the reading time 5 minutes and writing time. We're not going to discuss about the timings in this case note. Okay, straight into the writing task. Okay, so in this case note, you can see that using the information given in the case notes, write a letter of referral to the admitting officer at the emergency department, Children's New Hospital, Newtown. Okay, so it just says a referral letter you need to write. Okay, so a referral letter and to the admitting officer, Newtown Emergency Department, Children's Hospital. Okay, so the why we need to write this referral letter, we have to get it from the case note. That is the answer of your letter. So you have to explain that in a well organized manner. Okay, so moving forward to all the case notes. Sorry. Name of the patient is Joshua Vance, male, and date of birth is 17/11/2013. Normal vaginal delivery at 38 weeks gestation, and no perinatal or neonatal complications. Birth weight is 3,250 grams. Parents' name is given. Okay, on 31st/12/2013, okay, on routine 6-week baby check, patient's mother concerned regarding bowel reactions. Only one bowel actions every 3 days. Stools a little hard. Is breastfed. Only if breastfed. Stool is little hard only after 3 days. Okay. So making wet nappies and feeding well. Demand feeding. Sleeping through the night. So that was on routine 6-week baby check and subjective data from the mother. Okay, so examination 6-week check, good tone, hands and feet normal, hips normal, genitalia male, no hernia, no evidence of spina bifida occulta, abdominal, chest here exam normal, and frontalis normal, red reflex presence, nose and ears normal, palate intact, perianal examination normal, no tissues, no fissures, weight 3,900 grams, increased weight. Okay, assessment mild constipation in breastfed baby, otherwise normal 6-week check. Okay, again, plan was reassurance. Bowel habit variable in infants and can often settle. Try expressing milk from one feed a day and giving it in a bottle with some water, boiled and cooled to body temperature. Review within 2 weeks' time. Okay, so 13th of January 2014, after 2 weeks, 2 weeks, the review history was still hard stools every 3 days. Now waking up by crying, pulling legs up to chest every half hour throughout the night, pulls away from breast halfway through feeds. No vomiting, no fevers, no respiratory symptoms, making wet nappies. Examination, hydration status normal, abdominal examination, heart feces, perianal examination normal, no fissures, weight increased 4,200 gram. Assessment constipation no better, has put on weight, and plan was trial of coloxal drops daily, express milk from 2 feeds a day, and give it in a bottle with some water, boiled and cooled to body temperature. Review in 1 week time. So on 18th January 14th, history has not passed a bowel action for last 5 days. Refusing feeds. No wet nappies today. Vomit into one. No fevers. So examination irritable, 8.5 week old, mildly dehydrated, dry mucous membrane tissue, turgor and capillary return normal. Pulse is 120, respiratory rate is 30, abdominal examination, mild generalized tenderness, no guarded or rebound tenderness, weight is 4,100 gram, and assessment constipation and mild dehydration, refusing feeds, needs review at Children's Hospital Emergency Department for rehydration and further assessment regarding constipation. Okay, this is the case note. So the actual purpose is we have to write a letter of referral to the admitting officer at the emergency department. Okay, so what's your plan? So the reference is it is a reference letter, and think about what are the important things you have to check in the beginning itself. That is it a known case or not? Is it an emergency case or not? Yes, it is an emergency case because you are writing to an emergency department, and because of patient's rehydration and further assessment that needs to be done urgently. So it is an urgent kind of letter. Okay, is it is well known said here that it is for rehydration and it is for urgent assessment in emergency department. Okay, so these are the things hints that giving in the case notes if it is an emergency case or not. Okay, so moving forward to the next point, that is to whom you are writing, that we already known that to the admitting officer. Then again important things, the address of the recipient and the actual purpose of the letter. The actual purpose of the letter is to refer for what's the purpose you need to get from the recipient, is that need to further assessment and treatment of the patient's condition of rehydrate, need to be rehydrate, okay, for the dehydration and patient's condition. Okay, these are the purpose of the letter. You have to draft an introduction and come back, and when you're going to write the letter, so it is an emergency kind of letter. So what you have to say is, the date of your letter should be 18th of Jan 2014. So you have to say that what is the present, not the present income plan, instead present compliant of the patient that is in this paragraph. Yeah, so that means you have to talk about patient was came to you for routine examination after a couple of weeks or something like that, and mildly dehydrated dry mucous membrane was present, and tissue capillary returns was normal, and on abdominal examination mild generalized tenderness, no carding or rebound tenderness was present. So your assessment was constipation and mild dehydration. So because of the patient was refusing fluid feeds. So this was in the first body paragraph. Then you talk about the patient's history, like patient born on which date. Okay, so patient normal vaginal delivery on this 38 weeks gestation. You can talk about no other complications, but on routine 6 week check. Okay, so patient mother was concerned regarding bowel actions, that you needs to talk about. Then other than that, everything is fine. So mild constipation was the assessment done by you, and then you had reassured the mother regarding that is normal during that time, and tell her to review it within 2 weeks time. So in 2 weeks time it's again when worsen. So all these bits you have to tell in the third body paragraph, that mostly going to be the last body paragraph. So talking about the patient's condition was worsened, and what you have done abdominal examination of heart pieces found. Okay, for that constipation is not improving. That's why trial of coloxal drops was tried on that day. So then your letter was concluded. You can conclude as usual what we do in ending a letter. Okay, we'll see what's in your letter, then we'll come back to that in a minute. Okay. Okay, so the address part is fine. Okay, admitting officer, emergency department, Children's Hospital, Newtown, and 18th January 2014. Dear sir or madam, because yeah, that's regarding Joshua Vence. So needs to write still, 38 or 10 months old, whatever you have, or date of birth. Yeah, so you have to put the date of birth here. Okay, so moving forward to the introduction, I'm writing to refer Joshua, 10 months old male baby, has constipation and mild dehydration, requires further assessment. Require urgent, it should be urgent case. Okay, urgent assessment and management to your facility. Okay, that's the mentioned when I checked it initially. So that's the okay. All right. So today Joshua accompanied was accompanied to the hospital with 5 days history of constipation, and he has vomited once, refuses feeds, and not passed urine for today. Okay, he is found as irritated mild dehydration and dry mucous membrane. Mildly dehydrated and with dry mucous membrane. Okay, so that's the thing you need to be careful. Some of the constructions that we discussed. Okay, so small constructions, dry mucous membrane, mild generalized, that is just a typo. Generalized tenderness is found during his abdominal palpation, and his current weight is 4,100 gram. So this was the current state. So because of that dehydration, so you need urgent assessment, that is absolutely fine, and along with constipation, history of constipation. Okay, so Joshua was born on 17/11/2013 by normal vaginal delivery at 38 weeks gestation and weighed 3,250 grams. From his first 6 weeks routine checkup, her mother has been concerned regarding his constipation initially. Okay, so the construction again, initially he was not shown any symptoms. Moreover, all the assessments were normal, advised to increase oral fluids. So think about here. So the initially all assessments were normal, therefore advised to increase more oral fluids. Okay. So you can say and encouraged, reassured the mother. Okay, reassured the mother regarding constipation. Regarding constipation. Okay, right. So moving forward on the subsequent visit on 13th of January 2014, his mother was reported he was still constipated, and I was pulled his leg up to the chest throughout the night. Okay, okay. Here, what you can do is, so you can say on the subsequent visit on 13th first 2014, Joshua Joshua's condition was worsened. Okay, so you can write like that. So Joshua's condition worsened with worsened with no passing of stools and irritability. Okay, then you say moreover on palpation heart stool, horse stool, felted. Okay, so stools felted, or you can say, okay, that's absolutely fine at the moment. Okay, so other than that, if beneficial, if you could assess him and provide your management on his, okay, it would be highly appreciated if you can do whatever the needful. And if you have any queries, please do not hesitate to contact me. Okay, sincerely, Nurse. That's absolutely fine. Not too much bad, but it's still needs to be in focus on some of the uh, important constructions a little bit. So concentrate on that bit, and it will be okay for all of these letters. Okay, so good attempt. Oh, good. Okay, thank you.